Good morning, everyone. For those of you that don't know me, my name is Dr. Jake Tucker. I'm the owner and CEO here at Good Life Family Chiropractic. And today I wanted to begin our Daily Essentials series by going into the spinal warm-up. And this is something that should be done on a daily basis. It's also something that should be done in preparation for every single adjustment. And so oftentimes, and I've even been to these chiropractors, that are fantastic chiropractors, but haven't been taught about how to properly prepare the spine for an adjustment. And so one of the things I've found that as a practitioner, the spine adjusts better. Now you get a better experience as a patient when it's warm, when it has proper fluid exchange, and when there's proper blood flow, and when there's proper cerebrospinal fluid flow, when the discs are already mobilized, we can actually set the vertebra closer back to their normal position a lot easier just by beginning that process. So we're going to dive into that, and one of the tools that you guys have available for that is actually over here to my right, the website, the Good Life Family Chiropractic website. You can find this at goodlifefamilychiropractic.com, and where we're going to be going is, number one, we're going to drop into patient resources and the home care videos over here. So these are videos that are available for every single one of you, but it's just a great tool to go in and be able to see what you should be doing on a daily basis. Now, if you're a patient in our office, we've given you home care recommendations that correspond with every single one of these videos in here. But what I want to do is I want to start with the warm-up videos in this process, and that begins with the cervical traction unit. So let me make this full screen here. And this is Dr. Tony Nalda on my screen. He practices down in Celebration, Florida. He's the president of the Clear Institute for Scoliosis Reduction. And in his office, they're doing such high-level correction that he has people coming from all over the world. World leaders fly into Orlando to come see him in Celebration, Florida. And so I'm just going to let this go through. We'll mute the video so that it's not talking over me. But basically, I want to show you his demonstration of how to do this appropriately. So first, he goes into the door extender and some of the home care equipment that our patients are provided. You can find all these on our store at goodlifefamilychiropractic.com/store. But this unit actually helps to get proper mechanics in that traction pull. Traction that's done at a diagonal or even straight on, when a patient's prone or supine, isn't as effective at accomplishing some of these things as utilizing one that's straight up and down. And so you can see how he's assembling this off to the side. As he does this, you can see how you may want to best lock that into place. But let's skip forward in the video slightly so that we can see just exactly how we're going to do that. So here you can see he's setting up his patient, and I'm going to back out just a little bit so you can see how he puts that around the back of the neck. And that goes right in the middle of the neck. And you can move this up or move this down depending on where the stress in your spine is already out of place and where we need to work to start mobilizing that and creating more fluid motion and fluid biomechanics. But this is really just a great exercise to help to open up those disc spaces. He's talking about improper posture here. You definitely don't want to be shifting with your glutes too far posterior. You should be straight up and down when you're looking at you from the side. And so you can see how she's doing a light pull. This is not a strain. This is not an adjustment. You're not trying to mobilize or manipulate the spine with this. This is simply for motion, simply for blood flow and fluid flow. So from this, most people start off with about 20 repetitions, just 20 quick movements, moving through here lightly and quickly to promote that fluid flow. You're going to want to move into the other spinal warm-up exercises. And so we'll scroll down here to get to those. That's going to be your wobble cushion. Now, there's a bunch of exercises that you can do on the wobble disc to address specifically if you have a posterior T12 or a large enough LD, which we do with some people, but typically what we're doing is a series of 3 movements to help prepare the spine for an adjustment. So you can do this without a wobble cushion. It's not ideal, but it does absolutely still work just getting through these ranges of motion. Currently, with some of the accommodations that we're making in our office, we are not utilizing the wobble disc just to prevent contamination from one patient to the next and keeping us from having to clean everything between each patient. So we're going to fast forward here a little bit until they start with some of these side to side movements. So you can see that as they bend to the side over here, that they're also raising up that hip. That's a natural movement. It's not something that you have to think about, but as you bend side to side when you're on the disc, that just happens naturally. When you're on a flatter surface, even if it is cushioned, it won't have as much bending, but you can see she's moving fairly quickly through this. She's involving her neck, she's involving her shoulders, she's involving her low back, and by doing that, that absolutely helps with all the motions in the spine. Next, they're going through forward and back, and so we do want to get the 3 primary ranges of motion in every spinal segment as we do this, and so we're going to want to arch the spine forward, and then we're going to arch the spine backward. And as we do that, that helps to promote fluid flow through the disc and increase the range of motion through that as well. So she's going to be moving forward and backward through that quickly. See how her neck is involved in that? You can see that even all the way down to her tailbone, she's actually getting that motion. It looks like next he's going to be moving into rotation. Give that just a second. Yeah, he's starting to explain that rotation there with the neck and the shoulders, and then going the other way with the neck and the shoulders. And then you're also going to want to incorporate some lateral flexion in the hips. You notice how her hip is coming up on each side as she rotates and bends left to right. Now you should be bending your neck or twisting your neck more than she is there, but as with anything, if there is pain in any of those motions, let your chiropractor know, especially your max living chiropractor, who's qualified in how to address specific structural correction within these. So this is typically how we warm up the spine. I hope this was beneficial for you. If you aren't currently doing a daily spinal warm-up program, we will see that your spine will begin to suffer over time. So you can always call our office at 531-289-7100. You can talk with us. I can give you a specific protocol based off of your limitations and corrections that are necessary. But for episode 2, we'll actually be moving in and addressing the isometric exercises. So you'll definitely want to tune in for that. So if you have not subscribed, definitely click subscribe, like this video below, turn on notifications on our Facebook page or on our YouTube page so that you are notified every single time we go live or that we post a video, and you can get the rest of these. If you have a friend or family member that needs to see this, make sure that you tag them or share this video with them as well. So for myself, for the team here at Good Life Family Chiropractic, we wish you a great weekend. Be blessed, stay healthy, and I'll see you tomorrow for the next episode of our Daily Essentials video. Take care, guys.